It's good to have you back. Now, Johannesburg's water supply remains under pressure with demand currently exceeding supply. Some areas have not had water for over a week now, and there are growing fears that water restrictions could have an impact on hospitals as well as schools. So let's unpack this now with Professor Anthony Turton from the Centre for Environmental Management at the University of the Free State. Prof, good to have you. But I mean, this conversation that we are having here impacting so many lives, not having water. We're still in a pandemic, by the way. We need to still keep our hygiene up. What is going on and how are these water restrictions affecting South Africans?
Well, yeah, good morning to you and the listeners. Water is always an emotive issue, but it's actually an enormously complex issue. And while we have this immediate short-term acute shortage, there are some deep-seated issues within the water sector that we need to understand. And I would lump them under what I call the 3 C's. The Constitution, corruption, and cadre deployment. Those are the 3 C's that constantly pop their heads up. And on the constitutional side, when we promulgated the Water Services Act and the National Water Act, basically we devolved responsibility for water service management down to municipalities at the very same time that municipalities were undergoing the biggest transformation in their history in the form of cadre deployment. So basically, at the time that the municipalities were given the responsibility for forward planning, etc., at that very same time, they were losing skills at a tremendous rate and unable to do that forward planning. And then, of course, into the mix, you've got the usual suspect called corruption. And in this regard, there was a massive corrupt deal that was attempted by the Minister of Water Affairs, Nomvula Mokonyane, to try and hijack phase 2 of the Lesotho Highlands Water Project. But she was thwarted in her task by the Trans-Caledon Tunnel Authority, TCTA, proving just how robust these special purpose vehicles are. So that, in a nutshell, is the background to all of the woes that people are experiencing at the moment.
My goodness, Prof, you said a mouthful there. And I just wonder then, could our current water, crisis lead to it impacting on schools and even hospitals? I mean, my goodness, when I think about hospitals lacking water, that surely is a crisis that government needs to consider.
Well, yes, this is not new at all. If you go down to KZN in the municipality of Ugu around Port Shepstone, this has been happening for many, many years now. There are suburbs of Port Shepstone, Ramsgate, for example, hasn't had water for 3 months. The Murchison Hospital for some years has had an erratic water supply. Just hasn't had water. People have been unable to wash their hands. Medical staff undergoing surgical procedures are unable to sterilize between procedures, etc. And some of the schools in the Port Shepstone area have been forced to close down because of lack of water supply. But this has flown under the radar screen because it's in such a remote part of the country. But it's nothing new. So what's been happening in Port Shepstone for some years now is simply coming to the back door of those that live in Gauteng.
Yeah, and with that being said, Prof, how long should we expect this to continue for?
Well, it's going to carry on. In fact, it has to get worse before it gets better, for the simple reason that there's normally about a 20-year planning cycle. So when you're talking about infrastructure upgrades of this nature, you're talking typically in a short track, it would be 10 years, but generally about 20 years, because that's how long it takes, firstly, to plan, to do the forecasting, then to start doing the designing, and then to do the procurement. Now, these are long lead items. It's not going to happen overnight. You can't fix this problem overnight. It's not possible.
Yeah, unfortunately, that's not the news that we were hoping to hear. 10 years is quite a long time. Hopefully, of course, something can be done. Thank you so much for your time. Professor Anthony Turton, thank you for speaking to us this morning.